Alright doctors, right now I'm going to demonstrate how to put the finger cut on the end of the balloon. Just take a standard finger cut and place the extension approximately about a ½ an inch onto the balloon, and then just roll the balloon over the shaft. So you got approximately a ½ an inch. Then you're going to take your rubber band that you will buy at a drugstore. It'll be in the area where the girls get their rubber bands for the ponytails. They're made out of latex instead of standard rubber. Just going to put the balloon through it, stabilize it, twist it, stabilize it and twist it again. And I'm just keep twisting and twisting, and I'm just threading the needle through the balloon. And once I have it, then I want to double check that there's no leakage in the balloon, so I close the valve, just gently inflate it, kind of like I'm going to be doing it in the patient anyway, and then releasing it. Holding in my fingers somewhat, not squeezing it tight, but just making sure that I can see that the tip is fine. And then we get ready to prepare to actually place it in the patient's nasal passage as well, which I'll have a few cases that you can actually watch that to get an idea how that goes. Now, once the balloon is on, I use mentholatum, and what I have gotten into the habit over the years is I will have the patient inhale it just to make sure they don't have any hypersensitivity to the aromatic oils that are in mentholatum. You don't want to use Vicks, it's much too strong. The mentholatum is gentler. All I do is I just put a little bit on my finger. You have to have some type of lubricant on the balloon to go into the nasal passages. So all I'm doing at this time here, just saturating it fairly well, cleaning off the excess off my fingers. Then I keep the probes in alcohol, and like I'm going to be demonstrating in a few moments on these different patients, you're just basically making a little formation, a cup, as you start to go into the nose to enter the nasal passageway. Alright doctors, at this time I'm just going to do the procedure in real time, just to give a short update on this young lady here. I met Emily when she was 11 years old, and she had been having problems for approximately 5 years before I met her. She had a long history of recurrent sinus infections prior to me meeting her from young childhood. She did have some good chiropractic care for some neck and back ailments. The procedures that were done chiropractically, externally, had very little impact, and then that's where she was introduced to this methodology by referral. She's an excellent patient. She responded very, very well. She's here now. She's 14 at this stage. She was 11 when we met. Just had a short exacerbation, and I guess this is our third time that with the exacerbation. She did leave town, came back in, so we'll see if we get much bloody exudate out of her. But what I wanted to demonstrate is how easy and simple a young patient can tolerate this, and this is the way Emily was right from day one when we started this procedure. Mentholatum to lubricate the finger cut, and again I suggest to use a little mask in case it does stimulate some coughing on the patient's part. And the trick is to get the little cup, to get it into the inferior turbinate, a little air, and then I release it a little bit more. And there is some resistance at this stage. It's kind of snug, so we're just trying to work with it to see if it goes through. It's almost starting to move now. All right, the cough is a very common thing to occur. Very common to occur. And then ease up. Then we go to the other side and do the same procedure quickly. That's a girl. And she can feel, and I don't know if the tape is picking it up, but we can actually hear the palate moving as I inflate and deflate the balloon. Now I'm going into the middle turbinate, and then Brian, see if we can see the palate moving. Do you see the palate moving, Brian? That's it. We'll see if we can get that demonstrated. In the old days, you actually would have the balloon pop into the back of their throat, was the method that you wanted to use to make sure you have. But as you get better with this, you can just feel the balloon give, and that's the method I'm teaching you this weekend. The old timers would do it, and they would have the balloon pop in, and that's why I had this sharp piece on the back end. In case it got trapped, they would just pop it. But that's just a hair too aggressive. And the patient is instructed to breathe through their mouth, with Emily's doing quite well. We're doing all 3 turbinates on this patient, and once in a while you see that balloon pop out, so I'm just trying to compress enough to keep the balloon going backwards instead of forwards. You can follow up with some just auxiliary pressures. At this stage of the game is very beneficial. And then I have the patient come on up here with me. Have a seat here, Emily. Have you open your mouth nice and wide, head down just a hair more. Nice and wide, nice and wide, nice and wide. 1001, 1002, 1003. Very good. As you can see, there is a little bit of bloody discharge on my finger. We'll see how much comes out of Emily when she does her snorting and her blowing, etc. Last time I did it to her, or actually I should say the first time I did it to her with this exacerbation, there was a dramatic amount on my finger. Today it's very slight. Emily, how did you do in this, since I'm not really looking?
There's not much.
Not much, okay. So that was a big change from 2 visits, 3 visits to her, correct? Now we're going to see what comes out after she expels, because you want to examine the test. Now she's still got some bloodiness, so she's not as good as she was yet. Symptomatically though, you're feeling a lot better?
Oh yeah.
They'll always usually feel symptomatically improved before the blood stops. The goal is to get the blood stop. Now with Emily's case, when we first met her when she was 11 years old, it took a substantial amount of time. A number of months to get to that point at twice a week. But once we got it there, it didn't take much effort to keep her in that kind of shape when she would have periodic exacerbations. In fact, this last time, I think you fell off the wagon on doing all your good habits too, didn't you? Yeah, but she's back on plan B on wellness. All right, now we'll just do the same thing for the other side. Nice and wide. 1001, 1002, 1000. And this side here is a little more dramatic. And let's see what comes out in the sink here too. Okay, this one here is a little more dramatic, but again, nothing to the extent that it was when we first met each other. It would really just drip out of her nose when we first got started. But you can see it's fairly, aggressive at this stage of the game, but that's okay. It'll all settle itself down. All right, doctors, right now I want to just demonstrate how you can actually do the whole procedure sitting down. This young lady was kind enough, she's on her 2nd visit today. I'm going to have her tilt her head back just a hair, and just like you did when the patient was laying down, we're getting a little cup action. We're using the probe to gently bring the balloon into the inferior meatus. You're again occluding the opposite nostril, giving a slight increase in pressure and release. This is the only 2nd time I've done with this to the patient, so I'm still going nice and easy. The patient is already appreciating that the balloon is moving backwards much easier than it did the first time. Would you agree with this?
Ooh, yeah. Sorry.
That's okay. This natural coughing that you see is very typical of what you're seeing going on. It's stimulating the cough reflex as it's moving the balloon back. Mucus is moving also. We call this nasal specifics. If you Google it, you'll see a lot of medical literature on that, and we do have a lot of chiropractic literature on nasal specifics. A lot of SOTers use a similar method for intracranial adjusting.
Sorry.
And why I wanted to do this, I want you to see different reactions from different patients, because this is what you're going to see, and you're going to learn how to manage this with your bedside manner. Normally I would have a mask on, but due to circumstances beyond my control, now this probe is going up at a 45-degree angle to get to the middle one. And with the patient coughing, that's why you would normally want to wear some type of surgical mask. Up a little bit. And again, you can see the probe is on angle. Now here her nasal septum is slightly deviated, so I had to work with it a little bit to get it in. Again, gentle pressure and release, gentle pressure and release, and all done. And then have her clean the nose off a little bit. Since it's only her 2nd visit, I'm not going to do the superior turbinates. And now we're going to do her 2nd pharyngeal sweep. And she was so excited when I told her I was going to do this again to her. She just couldn't hold herself together. Yeah, the pharyngeal sweeps, nobody likes it, but it's highly effective, and I think we got a lot of blood out of you last time.
Oh,
too.
yeah.
And did I tell you, I didn't go in that deep with you, so I'm gonna go in deeper this time.
And I'm probably going to threat that vomit on
Nah,
you.
you're gonna be fine, you're gonna be fine. Now, doctors, I'm using the Audurol format of the silver as a topical. You have to use something type of antiseptic, because we are going into these recesses that can be highly infective, and so it's best to use something. Silver is fine, alcohol is fine. Some doctors have used hydrogen peroxide, you can use that, but the Audurol is good. Some people use phenylated iodine from DAG. All right, now, just gonna focus yourself a little bit here. Take a nice deep breath, blow it all out, and then put your chin down, just a little bit, down, 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 down. Wide, 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 wide. 1001, 1002, 1003. All right, go ahead. We won't worry about all the blood. You've seen plenty of blood already on all the other patients. But I want to just show you how the different reaction of different patients to doing this. Some handle it well. I would say this young lady is about typical. And it'll take her a few moments for her to clear herself up. Sometimes I'll let the patient rest for a moment or two. Sometimes I'll have the patient rinse their face, because she's draining right now. That's what's happening. And you want to encourage them to do exactly what she's trying to do, is spit some of that drainage out for her. All right, you ready for the other side?
Oh boy, sure.
Oh boy, sure.
Ugh.
I got a little deeper. I'm going to try again. Now, another thing you can do, which is what we're going to do with the patient right now, we're going to, as I get my finger where I want to be, some doctors will have the patient say ah, or the letter A. It helps the soft palate move for enough to give enough space from the posterior portion of the soft palate to open up to get above it, to get as far towards the anterior before you sweep out. So this time here, what I want you to do is, nice one, say the word ah, real loud, real loud, real loud, ah, no ah, all right. I got it.
Sorry.
That's okay. That's all right. What she was doing, she was opening up the arch. She just wasn't vocalizing the word the sound. But by doing what she did, she opened up the arch much greater. I got into this side more effectively than I did the other side. All right. And blow your nose too. Let's see if anything comes out the front end. All right.
Yeah.
Now she's getting a fair amount of blood on this side because I was able to get in more effectively. Because one thing I want you to realize, you never want to fight with the person. Force yourself on them. So when I went on the other side, I got some of it, but it was tight, which sometimes you'll notice. That's why I should have had to say the word ah on the other side. I neglected to do that. That's why I encourage on this side to do it, because it didn't open up as well as I wanted to. So this time when I got it to try at least to vocalize it opened up the arch nice. I got it much more effectively swept out, and it's much more demonstrable. You okay?
Yeah.
All right, thanks very much.
Thank you.
You're welcome.
5 years ago, I awoke with what I thought was ear problem, and I went to a medical doctor. She looked in my ears. She told me my ear was full of wax. She cleaned it out, gave me some antibiotics. I took the antibiotics, but nothing changed. I still had the pain. It was in the right side, and it just eventually started working its way. It started in the back, on the back of my skull, and eventually worked its way up into my right jaw. And after the antibiotics didn't work, I just started to do some research to try to figure out what was wrong with me, what was going on. I was guessing it wasn't my ear because I took the antibiotics and nothing changed. It just kept getting worse. But I've lived with pain in my right jaw for the past 5 years that it has radiated up into the side of my head, causes a lot of pressure in my ear, a lot of sinus. I was having a lot of sinus pressure and pain. Basically, I've been in pain every day of my life for the past 5 years, all in my skull. I've seen countless chiropractors in my area, and they've all done different manipulations on the neck down, but no one has ever addressed my skull. Just recently started seeing another chiropractor in my area, and he did some kinesiology testing on me, and had started asking me questions, had I ever had a head injury? And I started recalling that yes, I had had some head injuries, and he believed that what he was finding, everything was in my skull area, it was all in my head that was causing my problems. So when he brought that up, that made me want to dig into, well, okay, maybe this head injury, maybe that's caused some of my problems that I'm having. So I started getting on the internet and doing research, found out there's a procedure, what I call the balloon up the nose, but it's called endonasal specific or endonasal balloon, and just started doing a lot of research on that, believing that maybe that was something I needed to have done to me, that certainly nothing that I ever had done in my life or ever heard of it. And I did find a doctor in Dallas, Texas that treats, I did a TMJ Google search, and he does treat TMJ with the balloon up the nose, and actually had an appointment to see him on a Monday of this week, and I was really dreading the trip because the pressure that I was having in my ears, I'm feeling of being unbalanced, nothing spinning, but just feeling off balance continually was causing a lot of problems traveling in a car, a lot of anxiety, anxiousness, particularly traveling at higher speeds. So I was really dreading the trip to Dallas and doing a lot of praying and hoping I could find someone closer to home. And I just
Patty, can you come back to one, please, for a note?
And I just kept searching the internet, and finally found Dr. Fiscella. And I thought, well, St. Louis, surely to goodness, I can make it to St. Louis. And so my husband brought me here. What would have been a 3-hour trip turned out to be a 6-hour trip to get me here. But we have been doing the nasal treatment and the sweep, the pharyngeal sweep. First off, though, when I first saw Dr. Fiscella, he looked in my ears. That was the very first thing he did, and just was amazed that he couldn't even see my eardrum, and told me that we were going to have to address that first to get the ears cleaned out before he can even see what's going on in there, because the wax had built up so much it was covering my eardrum.
All right, now we're going to go for the superior turbinate, and that one you just glide right up the angle of following the angle of the nose superiorly.
I got spit.
You got to spit?
Yeah.
Good, you gotta spit. Everything we're trying to do is to get her to expel.
I do have a question.
Yes.
Does all this have to do with tonsil nuggets?
Tonsil nuggets? Well, there's terms in the literature that talks about tonsil nuggets. Those are just going to be little specks of plugged
Like-
mucus, things of this nature. I'm
Yeah.
assuming that's what you're talking about?
Yeah, it's
Yeah.
in my tonsils.
Yeah, yeah, well,
I've
that-
dealt with that for years.
Well, this procedure would have been what medical doctors would have done to you prior to the 1940s for any adenoidal or tonsillar, sinus, allergy, sore throat, laryngitis, bronchial irritation, all that, they would have gone in and done this.
Okay.
So the tonsillar, pellets that you're talking about, those are just plugs that are part of the infection portion, just like a little zit or blanket. Yes, that's what they are, because they call cryptic tonsillitis. And the tonsils should be like a smooth, but then they dry out, they get craters in them.
Oh, mine's got craters like the moon.
Because that's why you're in a situation when I milk you and all that stuff, a lot of that is all, the whole system is just backlogged. And it's been like that for years.
Makes sense, yeah.
It's been like this for years.
You wanna know how to get them out?
Well, what do you use, a toothbrush, you squeeze them, or a...
You know those little droppers, medicine droppers?
Yeah,
And I just go back in there and I just
try to
suck
suck it out.
Yeah,
Fine, whatever you get them out.
yeah.
Now, if you can find a guy up there in Paducah, Kentucky, he'll be able to get them out for you. And then last but not least, we have to go to the superior turbinate on this side. Now, sometimes you'll see the balloon doesn't get in there real good. You can work it in a little bit. If it unfolds itself evenly, fine. If not, you pull it out and you start over again. And that's why I go easy with my pressure and let the balloon try to, there we go. Pop goes the weasel.
Yeah. Wow, that stopped that ear up.
Yeah, that's very typical. It'll open itself up naturally. All it is was just pressure was going in. The eustachian tube is over here. It just, and it's trying to pressure to equalize that. Nice and wide. Hold on for me. Hold on. 1001, 1002. Well done.
That one wasn't as bad as yesterday.
Good. You're not done yet. Make them out now.
Yeah, we got a chunk out of that left side yesterday.
Okay.
Battle
Now,
strategy.
I didn't feel this all the way up yesterday, should I?
Yeah, go ahead.
Yeah, okay.
Halfway, more than that, whatever you feel. Like I said, we're trying to do quite a bit because she's loosening a lot up quickly. So we want to rinse that out. Now, obviously, when you're home, you don't have to do as much, but if you need it, go ahead and do it.
Oh, okay, gotcha.
And that's not so good. That means, she had just a smidgen. I said, hey, man, she's pretty much over the humble as far as I can bring her. But see, I haven't brought her to the level that she's gonna be. How do you know? Because the amount of blood comes out of her. The guy that I dismissed, I mean, I dug him out 2, 3, 4 seconds, 2, 3, 4 seconds. Not even a drop, like a smaller than a pinhead amount of blood. Your wife.
That was a chunk.
That's, I know it's a challenge distance-wise. So one, either find somebody who's closer to you, who's proficient at it, or we'll work something out. I don't blame you. If I was in your shoes, I'd be trying to.
Well, I'd really like to take you with me. That's what I hear me. I'd fly him to Paducah.
All right, doctors, at this time I'm going to demonstrate the use of Q-tips using colloidal silver preparations and/or the stronger version that I referred to in the past as called Argirol. And I wanted to just use this model here to kind of demonstrate what we're trying to do. You'll saturate the Q-tips individually on one side. You're going to gently place the Q-tip into the inferior nasal meatus, and then some folks you can get it into the middle one. Very rarely have I seen people can tolerate the upper, but for sure the lower and the middle if you can get away with it. And then the patient just sits there for 2 to 5 to 10 minutes basically snorting whatever they can. It does stimulate more purging of the mucus, and you just kind of go with it. Some authorities I've read have recommended an hour. Dr. Yoakum did it for 12 minutes with an infrared in front of the patient, and they had like a little medical dish that they would, have mucus running out. It's, obviously it's real disgusting, but very, very purgative and very, very beneficial for the patients. And today, Tammy, as you met her before, she came back in. It's been a while. It's been about 3 weeks since we've seen her. There was troubles with transportation and Thanksgiving. But she came in yesterday, I did it last night, and then she came in this morning, and then she's getting out of Dodge in a few moments, but she volunteered for me to teach her how to do this at home. It's where I have the patient do this to try to help themselves. They can't puncture anything, they can't rupture anything, because really the discomfort is going to stop them from getting anywhere at that point. But I'm hoping I can demonstrate how far you can really go in with this. Now I'm using the stronger portion of the silver preparations. The patient will always leave with either a minimum of 500 or preferably 1100 parts per million. And I've given you the information on the powder that you can have your compounding pharmacist. You do not need a prescription for this item to utilize to make the Ardurol concentration, which is 100 times stronger than the 1100 parts per million. As you can see, I got the ends of the Q-tips well saturated. You're going to stand on either side. I'm a right-handed person, so I sit on this side. As you're going to do, it's just like when you did the balloon up the nose. You're just going to follow and then drop in. And now as I go back, I'm meeting resistance there. So this is Tammy's first time. I'm just going to stop at that point. We may not get a little further on this side. And again, I feel resistance, so I'm going to stop at that point. I am going to attempt to see if I can get into the middle meatus. Remember, the middle meatus is where your maxillary sinus and other sinuses in front of you drain into. So the more we can stimulate the purging at that level, the more responsive you're going to be. The lower one is more for the eye, but as you well know, it is the largest of them all, and that's why I like to concentrate on that area first when I get started on all my preparations. Have you got a sneeze or anything? You're okay?
No, it's just making my eyes water.
Yeah, now notice how it's making eye. Why? Because you have the orifice for the lacrimal duct is ending at the inferior meatus, and that's what's stimulating that reaction to her eye. Alright doctors, what I'm going to do is I'm going to demonstrate how doctors do it with multiple balloons. What they'll do is just take one balloon, put it over the shaft, open it all the way up to its maximum. Take another balloon, roll it all the way down to its shaft, so it's wide, it's extended to its maximum. And some guys will go 2 to 5 balloons. I have really only done it a few times. I just found it way too painful, and when you do with your rolling, you're going to have to be a little bit more conscientious. I would pull it down. So again, you're trying to get as much of the balloon to go into the patient's nose, but have enough on the shaft that you can make a tight fit. Grab your rubber band, and you open it up, and you put your fishtail, the balloon into it, hold it, and then just gently twist. Catch another grab, and then all it does is just keeps rolling over, and with multiple balloons, I would definitely do it several times. And then as you go to inflate, it's much more restrictive, and it's stronger. And you can make your own decision. I prefer to use the other form because it's gentle. It doesn't have to take as much force and pressure when you go do the nasal specifics, pressing on those inflamed mucous membranes of the nasal passages. In addition, doctors, I recommend using a mask because the patient will be stimulated and coughing on you. I've been doing this a lot of times, and years ago I would kind of not wear it, and that was silly. Now I'm being much more careful about it, so I'm suggesting for you guys to do the same thing. And some of you, we're not going to be demonstrating this weekend. Obviously, I talked about it. You've seen me in the lecture PowerPoint portion of the seminar. But this is one of the very common tools that you can use for irrigating the ear. You can buy it in any medical shop. They're very convenient. Nowadays, they have adult syringes. You can buy them with the bulb. It depends if that's what you get yourself, you want to get yourself into. But like I mentioned before, the deep rocks, the patient can kind of clear it out itself. You want to be making sure you look in the ear to make sure that the wax is totally removed, so you can finally see the eardrum, and then as well as examine it properly at that point. The patient will be going home with a lot of homework. We have, we make misters, or you've heard me mention it before, with the alkaloid and the colloidal silver. The Argerol is the one that you will have to get that made at a pharmacy. You have all the information for that. And of course, the alkaloid, the product's been around since 1896, your local drugstore, but I did give you the information if you want to order direct. And then the Neely meds, again, we keep the components of the Neely med in alcohol, and then the patient can rinse the noses out. Some doctors prefer to have the patient bring their own, excellent recommendation, but this would be second best for what we do.